want to talk about something I hear all the time. Why is she on a GLP-1 weight loss medication? She's already skinny. I see it online. I hear it in conversations, and sometimes it's not even said out loud. It's just assumed. And on the surface, I understand why people think that. But today, I want to slow this conversation down because what you see on the outside is rarely the full story when it comes to health, metabolism, or weight regulation. And if we don't talk about this with more nuance, we end up spreading misinformation, judgment, and a lot of unnecessary frustration. This conversation is for education and support, not medical advice or personal attacks. My name is Dr. Kisha Pickford, and I'm a nurse practitioner and a holistic nutrition weight loss coach. And I work with women, especially women over 40, who are navigating weight loss with or without medication. And I personally use GLP-1 weight loss medications. So I share what comes from both a clinical and a lived experience. And this is Weight Talk Thursdays, where we keep it heart-centered, hormone-friendly, and real-life approved. Here's the first thing we need to clear up. Weight does not equal metabolic health. You cannot see insulin resistance, you cannot see hormonal imbalance, and you cannot see inflammation. You can't even see prediabetes or PCOS. You cannot see autoimmune conditions. And you also cannot see someone's weight loss history. Some people who look thin have spent years weight cycling. Some are managing chronic metabolic conditions, and some are preventing regain after significant weight loss. And some are using medication as part of a long-term health strategy, not a cosmetic one. You cannot diagnose health from a mirror, a red carpet, or a social media post. One of the things I've learned over the years as a nurse practitioner is this. Some of the most metabolically unhealthy patients I've seen were people everyone else thought looked fine. And some of the women who struggled the most with food, weight, and hormones were the ones who were constantly told, "You don't look like you need help." That disconnection is dangerous because it minimizes real struggle and delays real support. And personally, even as a healthcare provider, I had to unlearn the idea that appearance equals ease. Health is not about how someone looks. It's about how the body is functioning. And let me give you a real life example from my clinical experience. I had a patient who, by every outside measure, looked like she was doing just fine. She wasn't overweight. She dressed very well. She exercised regularly. And if you passed by her in the hallway, you would never think she was struggling. But when we looked deeper at her labs, they told a completely different story. She had significant insulin resistance. Her A1C was creeping up every day. Her fasting insulin was elevated. She was constantly fatigued, and despite doing all the right things, her body was never responding to anything. She had spent years being told, "You're fine. You don't look like you need help." And what that really meant was that her concerns were being dismissed because of how she looked. When we finally addressed what was happening metabolically, not cosmetically, things started to shift. Not because she suddenly tried harder and not because she lacked willpower before, but because her body needed support and not judgment. And that's why I'm always cautious when people make assumptions based on appearance. Looking okay does not mean the body is functioning well. And that's the piece that often gets missed in these conversations. When we reduce health to how someone looks, we silence real struggles and we delay real care. And this is exactly why education matters more than opinions. When women understand what's actually happening in their bodies, especially after 40, the noise gets quieter and the decisions get clearer. Some women start by reading my book, The Wait is Over, to understand the deeper drivers of weight gain and weight loss after 40. Others want a guided breakdown, which is why I created my on-demand masterclass. And for women who want support, structure, and accountability, that's where my Fresh Start Holistic Weight Loss Program comes in. There's no right order, just the next step that helps you feel informed and supported. So the next time you hear someone say, she's already skinny, why is she on a GLP-1 weight loss medicine? I want you to remember this. You're seeing a body, not a diagnosis, an appearance, not a history, a moment, and not the full picture. In the next Weight Talk Thursdays, we're going to talk about another important piece of this conversation. What people with diabetes are saying about GLP-1 medications and how we approach that discussion with compassion and clarity. But before we wrap up, I want to leave you with a simple challenge for the week. Between now and the next time we talk, I want you to notice when judgment shows up, either from others or from your own inner voice. Pay attention to moments when you feel the need to explain your health choices. You catch yourself comparing your journey to someone else's, or you start questioning your decision because of someone's opinion. And when that happens, I want you to pause and ask yourself one question. What do I actually know about my body beyond what anyone else can see? Then, if you're comfortable, come back and drop one insight or realization in the comments. Not to defend yourself, but to reflect and reclaim your story. Well, that's all I have for this episode. Thank you for joining and listening today. I want you to remember your health is not a secret. It's your story, so own it. Until next time, please stay healthy and please be safe. Bye.